areas of our state to address the headwinds that are heading us our way. We talked about the big ugly bill, the impact on New York, and we still have many unknowns, and we cannot mask the consequences that this will have for our state. First of all, it'll utterly destabilize our health insurance program, cuts of about $13 billion a year between New York State and our overall health care system. 1.5 million New Yorkers will be stripped of health insurance, something that many of us, when we were in Congress, fought for from the Affordable Care Act. It'll be cutting essential funding for hospitals and healthcare systems, and without a doubt, putting lives at risk. Medicaid is literally the lifeline for 1 in 3 New Yorkers. Cutting this essential healthcare doesn't keep people from getting sick. It doesn't stop babies from being born. It's simply saying you're on your own, tearing apart the safety net that people in this country have come to rely on throughout their lives. It'll be higher costs for our hospitals, a greater strain on them because people will have to go somewhere. And it doesn't just affect people on Medicaid. I want to be very clear about this. For those who say, well, I'm not on Medicaid, it doesn't affect me, when that hospital, perhaps one of 5 in the North Country, closes, you and your family don't have anywhere to go either. If you have an accident, car accident, need some emergency treatments, they're not there for you either. And so in areas like that, our rural parts of the state, and most of our state is rural, you have to drive great distance to other hospitals if we start closing them down. Now, it's not just our health. That's the first impact, perhaps the most frightening. But also, if we stop feeding people, 3 million people in the state of New York will have their food benefits jeopardized. They rely on this. They're receiving these benefits because they don't have an alternative. And it totally ignores the fact that so many people are already struggling, tone deaf to what is happening among their own constituents, the people who voted for this, these 7 New York Republicans who voted against their districts. Now, this is going to have economic harm, and the SNAP benefits alone. Think about our agricultural community, the farmers. My God, the most resilient people on earth have to be our farmers, dealing with the winds and climate change and pests and tariffs. And now an outlet for them to be able to sell their products to. I was up in Saranac Lake at a farmer's market. The farmer there brought his crops in. I said, is this a big deal for you? He says, look at how many stamps I collected. This is critically important for him. He worries about the people who won't get the fresh produce, but he also knows this is going to hurt an important outlet for him. So the human toll of this is beyond unconscionable. It's an intentional infliction of pain on the people of this great state in our country. It's taking a wrecking ball to the lives of the most vulnerable. For what purpose? Why is this happening? To fund tax breaks for the most privileged, the wealthiest, millionaires and billionaires who, last I checked, are doing just fine. They're not worried about a meal on their table, whether there's health care for their children. What's really cynical about what they just did, they postponed some of the pain till later, hoping that New Yorkers will have amnesia when it comes election time next year and forget what they've unleashed on their own districts. I won't let them forget. They will not get away with this. New Yorkers will know who voted callously to disregard the needs of their district, their constituents, and there are consequences. Now, the challenge that lies before us, and again, I want to acknowledge my team that's here. We're looking at a $750 million hit in the fourth quarter of this year, January till March, and a staggering $3 billion next year. That's why I've directed my agencies to identify creative strategies that will limit long-term damage to vital programs. But also, during our budget process, we had some instinct that this would happen, something would happen. That's why we stopped $400 billion in spending that was anticipated back during our budgeting process. That's why our one-time $3 billion inflation rebate is now a $2 billion inflation rebate, cutting a program that I believe in, but also trying to be cognizant of the fact that we may need that money for future challenges. Again, not knowing the details. And truthfully, we don't have the full picture of what's going to happen because this is just reconciliation, which doesn't mean a lot to people. All they know this is going to be painful. But the budget that could even wreak more havoc on us comes out this fall. So the clear scenario that shows us exactly what is happening is not there entirely. But we're prepared. As I said, we talked about this spring after the Trump election, and he started telegraphing what his intentions were. So we've been ready. We're prepared. And I want people to know this. They have a state government filled with incredibly competent people who will get us through this. Unlike Republicans in Washington, we actually care about families. We worry about them. We stress about them. And we actually have something called compassion for those whom life has been hard. And I'll continue to make every New Yorker my top priority as we go through these storms. I asked a number of my members of my cabinet to join us here today. We have Secretary to the Governor, Karen Keogh, Catherine Garcia, the Director of State Operations, Brian Mahana, our Counsel to the Governor, Blake Washington, our Budget Director. But I also invited some people from the agencies. So if you have questions about some of the impact on specific agencies, you can hear from Willow Bear, the Commissioner of the Office of People with Developmental Disabilities, Richard Ball, the Commissioner of Agriculture and Markets, Jackie Bray, the Commissioner of Homeland Security and Emergency Services, Barbara Gwynn, the Commissioner of the Office of Temporary and Disability Assistance, Hope Knight, President of Empire State Development, Dr. James McDonald, the Commissioner of the Department of Health, and Ruth Ann Visnaskis, the Director of Community Homes and Community Renewal. They're here because they're the ones that are going to have to help us navigate these uncharted waters, these unnecessarily rough waters. But we're ready for this. We know how to do this. We've been through battles before. We've had challenges. I was governor just about 2.5 months when Omicron hit. Then we had inflation. Then we had supply chain challenges. Then we had the migration wave of 220-some thousand people arriving in our state. So we're battle tested. We're ready to lead. We have been leading. But I want you to have an opportunity to ask questions directly from the people that will be joining me in our efforts to just manage this crisis inflicted upon all of us from the President and the Republicans in the state of New York who did not have the political courage to cast a vote against something that they knew would be devastating for their own districts.
Well, first, I heard that you have a new granddaughter,
Yes, thank
Governor.
you.
Congratulations.
Thank you very much. Thank you.
Very exciting. So my understanding, obviously, there's a lot in this big, beautiful bill, and you've outlined a number of the points. But my understanding is that sort of the biggest hit New York State is going to take is from its practice of providing health care for undocumented people. I'm curious, just from a purely fiscal perspective, whether or not you are considering any sort of legislative action to change the state's policy. Is that to kind of capitulate to the Trump administration and stop covering those healthcare services? Is that something that's on the table?
We're having discussions now internally, but also with the leaders. We'll be engaging the leaders of the legislature during this time when we have an opportunity to really assess the impacts. Program like that, I think, is about $3 billion. Is there anything to add to that, Blake?
The one thing I'll add, Governor, is that most of the persons we're talking about, the non-citizens that are covered under current law, are are green card holders and persons that have been here, large case, plus or minus 5 years, and preceding the crisis in many cases of just the last year and a half, 2 years. So.
But you are still considering looking at whether the state will continue to cover their health care?
If the state were to cover 100% of those persons as they migrate to the general fund only, it would cost $3 billion. So that's the public number we're carrying.
Governor, and for Commissioner Ball, I'm actually curious because the bill boosts funding for ICE. Obviously, we've seen deportations ramp up in New York. I'm curious about how that's affecting farms in New York. Are farmers concerned about that, and what is the impact, I guess, on the state overall from those actions?
I'll let the commissioner address that, but are farmers concerned? They're just so shocked that someone they probably voted for has turned on them in this way. Not just the family in Sackett's Harbor, Tom Homan's hometown that I think I've talked to you about before, where a third grader and her twin brothers in high school and their mother were whisked off to a detention camp. Dad wasn't home because why? At 6 a.m. on a Saturday, he was milking cows. ICE agents burst in the door, blaring their guns with, of course, the masks to cover up their identity. That farm community, that rural community, I will go out on a limb and say that probably Republican community was outraged by those actions. The community rose up. I got involved. The family was returned. But that had a ripple effect throughout the state. Then when I was in the North Country in Saranac Lake a couple weeks ago, I had 400 people in a village hall. Standing room only, people wanted to hear what I had to say about the impacts of tariffs, the health care cuts, the impact of the Canadians not coming over. Therefore, the downtowns are no longer chock full of tourists this time of year. But what got the most attention in that conversation, I let all these individuals speak about what the impacts were being felt. When the farmer got up and talked about, someone from the Farm Bureau talked about the raids on farms and how, first of all, at a human level, these are relationships that have built over years. Same people go back year after year to the farms and provide an indispensable service to us. They also talked about the terror of seeing people unidentified arriving, guns, masks, not sure if this is a legitimate raid or someone masquerading as ICE. So first of all, there's a fear factor. Then the question is, who's milking the cows today? If the workers are rounded up, thrown in vans and taken away to detention centers, who is taking care of the crops? Who's managing the farm? So Commissioner Ball can give you more details, but the fear is palpable across our state. And the sense of betrayal that they're experiencing is very real. Commissioner Ball?
Yeah, thank you, Governor. I think the governor articulated the situation pretty well. I think the level of uncertainty on our farms across the state is very, very high. We rely on a workforce. This is not just simply a workforce issue. It's a food security issue. It becomes an animal welfare issue. How do we take care of the animals? How do we supply the food? How do we get the job done? And I really have to say that this has been a failure by the federal government for decades to deal with a workable guest worker program. We want our workers to be legal and have legal status in the United States of America, and it hasn't been dealt with in decades. But the pressure right now on our farms is enormous, and wondering if on the kitchen table in the morning before a farmer heads out, if he's going to be able to get the work done, what's going to happen on his farms. That uncertainty in the workforce, that uncertainty on the farm is very, very difficult, very palpable. For the workers, many workers are disappearing. They're not showing up to work, and they're afraid to go to Walmart on Saturday. They're afraid to go to church on Sunday because they'll be targeted because of their ethnicity. So it's a huge factor.
Any other comments?
Governor, Commissioner McDonald. On the subject of North Country hospitals, obviously many of them treat a lot of Medicare and Medicaid covered individuals. These cuts are predicted to have outsized impact on those hospitals. Is there anything the state is able to do to buoy a hospital that is in danger of failing? And are you considering any specific interventions at this time?
No, we have to look at the whole picture. Again, I would encourage all of you to ask the members of Congress who represent those areas what they plan to do about it. What are they telling the hospital administrators who came to my forum and are in a panic? What are you telling the healthcare workers who will lose their jobs? An estimated 67,000 healthcare workers will lose their jobs. So I would first ask the question, before you ask me, ask them how they plan to deal with this. That is a fair and legitimate question that I'm not hearing enough of. But as far as how we're managing this, it's going to be talk about all these areas that are going to need funding that used to come from the federal government. I'll tell you right now, there is not a single state in our nation that fill that loss of money. We get $93 billion a year directly from the federal government, not including all the money that goes directly to hospitals. As I mentioned, $13.5 billion loss in money. So, Blake, we're talking about the options here, but that has not been determined yet of what we can add, other than it is a huge concern of ours. Anything else?
Yeah, thank you, Governor. So a couple points. I think, yeah, I'm worried about hospitals in North Country. I'm worried about all the hospitals, though. So there's a couple things that we can do and really things we should do. One of the things we've been trying to do in New York is help hospitals and nursing homes lower healthcare costs. Part of that's by looking at scope of practice of healthcare providers in New York State. You know, we proposed this in the budget this year. It didn't happen, but medication aids in nursing homes, 38 states do this. New York hasn't done this yet. We need the legislature to help us with that. Another example of where we could use some help, there's a nursing shortage. Now, we have over $700 million that New York is investing between now and March 31st of 2027. We have 3 workforce innovation organizations. We are doing a lot to get more people interested in healthcare. But we have to look at some of the basic things. If every other state figured out a solution, why haven't we? And one of the things where we have an answer is like a medical assistant can give a vaccine in 49 other states, in the military, in the VA, in the Indian Health Service, everywhere else. This is something where we have nurses simply working just to give a vaccine. We can't keep doing these things. We have to catch up with other states in these spaces. So one of the things we need to focus on is how do we listen to what hospitals are asking us to do, what nursing homes are asking us to do, and I just need the legislature to partner with us on some of these things. And one of the things I want to share with all of you too is I actually read the entire 870-page bill. And some of you haven't because there's stories to be told there, my friends. But there's a lot of nooks and crannies in there. Go look around page 630 where you talk about Medicaid. One of the little nooks and crannies in there that's just sort of fascinating to me is they expect states to charge people at the federal poverty line to 138%, a copay up to $35. Now, I don't expect people to know the federal poverty limit off the top of your head, but that's a little over $15,000 for an individual for 100% federal poverty and around $22,000 for 138%. I don't know if you guys know this, but most people making between $15,000 to $22,000 a year can't afford $1 to pay for a healthcare service, let alone up to $35. There's a lot of things in this law that I think people need to look at and wonder, what were people thinking? It's certainly it's not about making anyone healthy again, though, my friends.
Can I just reinforce what you said about the scope of practice? This is an enormous source of frustration for me, that we can't get the legislature and the Department of Education to sign on to what other states are doing, which is to allow highly trained individuals to take on one more activity instead of us having to hire 2 people to do that activity, with the person for the primary nursing and then someone to administer other vaccinations. So I'm just fed up with the absurdity of some of these policies, to be honest with you. There's no reason why we should not be leaning hard into finding all the ways that we can support health care. And as he raised that again, I could hear the frustration in his voice, and my blood pressure went up a little bit, because this is something that should have happened a long time ago, and we're going to take it on once again. We just need more cooperation.
Governor, on the work requirements for Medicaid, what have you been doing so far to prepare for these changes? And I know in other states, putting a program together like this in such a short amount of time has created difficulties. So, how is New York gonna, proceed with this? I know it's a short requirement that you have.
No, certainly, and we spoke about this at our cabinet meeting this morning, and Catherine Garcia, our head of state operations, identified how challenging this is, but also explained that we'll get it done. Catherine?
Absolutely. We've been looking at this for a while in terms of how are we going to build the Tiger team to drive this over the line. It's in some ways a big IT challenge, but right this second, we don't have the full rules of the road of what is work requirements or volunteer or education 80 hours a month. What is going to be acceptable to the federal government when we do the submissions to be able to move forward. But we know that it's going to happen in SNAP, we know that it's going to happen in Medicaid, that we have a system and a program that can work across all of those.
And what would you do to ensure that this doesn't lead to people being just dropped from the program? Because I know in a lot of places where this is put in, the intention is to shrink the Medicaid program.
Well, there wouldn't be savings attached to it if they didn't assume that people would drop out. We are going to do a ton of outreach and try and make that happen. But let's be clear. We do anticipate that folks will struggle to continuously recertify every 6 months and have all of the documentation that they're going to need to have to meet this requirement. That's what we have seen historically, and this is what the federal government very intentionally is doing. But we will work through our nonprofits, work through our local government organizations to assist and ensure that people are able to transition to regular Medicaid. But we know that it's tough, and the recertification clock is very hard for people.
Governor, I believe you mentioned directing commissioners to identify areas within their own agencies that they can find deficiencies. What do some of those look like potentially, and are personnel cuts on the table?
These are issues I'll be speaking to the leaders about as well, about what number we need to hit and how we want to hit it. So I'm not going to talk about cuts at this time. I'm going to tell you that those conversations are very robust. But each department head knows where they can go. I mean, for example, the MTA, we told them to find, was it, Catherine, $3 billion?
Well, $300 million to
300
fund the $3 billion.
Yeah, $300 million. We directed them to find $300 million. They will find $300 million. So I will leave it to the agency heads, unless Catherine or Blake, you want to add anything to how that unfolds. But, definitely using more technology in areas where we have some restrictions on how that can be done, but we want to use technology more efficient. And Blake, I know you've given some thought to this as well.
Yes, Governor. I think the real thing is getting some organic proposals from the agencies, helping them, working through division budget and ops team to inform the process. Sometimes agencies, just because they have a very particular mission, become siloed on what they do, but some of the core fundamentals across agencies remain the same. So just encouraging partnership and collaboration, I think, is sort of the low-lying fruit, getting a little bit kicking the tires, scrutinizing incoming expenditures, making sure that the ones that are the highest and best use of state resources, protecting the taxpayer, but also making sure that the high-quality services that we deliver in the state of New York continue to be so. So it's going to be an iterative process, one that we're going to work through in the next handful of months, and certainly through budget development in the fall.
Yeah, Governor, you made a reference to not letting them get away with it. Could you elaborate on that? Are you talking about going on the campaign trail? Like, what do you mean when you're saying?
Oh, no, we already are. I'll be if Congressman Ryan isn't having to cast votes tomorrow, I'll be in Kingston tomorrow with him, highlighting, spotlighting how devastating this is, let him tell his district about what he is fighting for. But then one of the reasons I was up in other parts of the state, as I've just described, we're taking it on the road because people need to know what we're doing and the incredible contrast between how New York State, our state government, is fighting for people and putting more money back in people's contrast to what the Republicans have done to them. So, no, that's already started.
Is that also Western New York? I know you mentioned Ryan's district. What about
It's all on the schedule. Got a very aggressive travel schedule for the next few months. Thank you. All right, thank you. Oh. All right, let's